you're probably using nasal sprays wrong. That means nasal steroids and nasal antihistamines. It's not just a case of shove it up your nose and spray and hope for the best. There is a specific technique to it. The first thing to do is to make sure that you don't have any bogies or mucus or phlegm or anything up your nose. You can do this by doing a nasal saline rinse. You can also use a hypertonic saline if needed, but we want to get rid of all the bogies and boogers because we want the medication to be working on the skin inside your nose rather than on the bogies, because that won't have any kind of effect. If you don't have access to saline rinses and things like that, then at the very least, make sure you do a really good blowing of your nose. The next thing is the technique and the direction that we want to do it. So it's not going up your nose, it's not going backwards, it's actually going out and diagonal. So the way that I advise my patients is to use your right hand for your left nostril, this is my right hand, your left nostril, and aim for your left ear. That's because the passageways are kind of up here, they're up and out. And same for the other side. So it would be left hand for my right nostril and aim for my right ear. Now, because the passageways don't go up, they actually kind of go backwards. You also want to tilt your head forward. And by tilting your head forward, it just makes it a bit easier to get the correct angle. So the way that I would recommend is right hand, left nostril, and we're kind of going, you can see where I'm moving my big nose. We're going kind of around there, where the passageway is. And I'm aiming for my left ear, and then I just spray. So then the next tip is that you shouldn't be snorting it, because if you start snorting it and you sniff, then all you're doing is it's just going to the back of your throat, you're going to taste it, and it's not coming into contact with the skin and the tissues locally, and it's basically a wasted dose. So I'll now show you on the other side. So we're going from my left hand into my right nostril, and we're going wide, like we're going wide. I'm aiming for this ear, and I'm putting it there, and I just want to leave it in the nasal passageways for as long as possible. Don't sneeze, don't blow your nose, don't sniff it. Just try and let it sit there for as long as you possibly can. Let me know if you have any questions, and send this to someone who's using nasal sprays.